medical tourism, page 436. So what is medical tourism? When a person travels to another country for medical care, that is medical tourism. Okay. You have to travel to some other, you have to take a visa, passport, travel into another country to get some medical help, aid, surgery done, or even consultation. Okay. That also comes under medical tourism. So what are the reasons why medical tourism takes place? First is cost. The country that you're targeting, okay, they might have the same treatment done for you at a very cheap rate as compared to the country that you belong to. Okay, like certain medications, certain surgeries in USA are like way beyond a common man's budget. Okay, but those surgeries can be done in India or other developing country with good skilled specialized staff at one-fourth of the rate. Okay, so cost is a main factor why people opt for medical tourism. So they come here even as tourists just to visit the country and they get their work done, medical work done, and then they leave. Okay, so cost is a major factor. Then culture, certain practices, okay, certain practices cannot be allowed in certain countries. Okay, in some countries abortions may not be allowed. Okay, so any woman who wants to get an abortion done, she may travel to some other country and get the abortion done where it is legal to get abortions. Okay, in India it's legal to get abortion if it's a woman's choice. If she does not want to keep the child, she can abort the child. Okay, some countries it is banned, you can't uh, do abortion. So that is a cultural example of a cultural aspect. So even certain procedures may not be allowed in certain countries. Okay, certain procedures may not be allowed in certain countries. So culturally, uh, if certain procedures are not allowed in your home state, you may have to go to some other country to get the procedure done. Okay, some cosmetic procedure or some other skin mutilation procedures, etc. Then unavailable or unapproved procedures. Uh, some procedures may be banned in certain countries. Okay, or if it is not available, they may not have the skilled people to carry out certain tasks or certain procedures. Okay, or their government does not approve it, like euthanasia. In India it is not approved, but in Switzerland euthanasia is approved. Okay, so you may travel to Switzerland, get their citizenship or something, and do certain procedures. Okay, so that's an example of it. So these are the reasons why medical tourism is thriving. Then procedures, the most common procedures that people undergo on medical tourism include dental care, surgeries, cosmetic surgeries, fertility treatments, which are very costly in Western countries. In India or even in Middle Eastern countries, it is still affordable fertility treatments, organ or tissue transplantation procedures, cancer treatments. Okay, these are the most common procedures for which people travel to a different country. So medical tourism can be risky as well. Reason being infectious disease. If you are staying in a hospital, you came here as a tourist, you underwent certain procedures, okay, and you are staying for 2-3 weeks in a hospital, the risk of developing an infectious disease is quite high. Okay, getting a healthcare associated infection is quite high. Okay, so infectious disease risk is always there. And also, when you change countries, you have to get vaccinated against certain diseases. And or every time the vaccination cannot be successful. You can still succumb to certain injuries or infections. Okay, like in India, tuberculosis bacteria is very much prevalent. Okay, Indians kind of have an immunity against it. Tourists, they don't have that immunity, so they may catch up certain diseases that their body is not used to, but it is very common to Indians that they don't get infected. Okay, so catching infectious disease is a risk. Then antibiotic resistance. Okay, continuing antibiotics for a long term, as long as they're admitted here, okay, and not following the same protocol or leaving the antibiotics in midway of the treatment when they move back to their country, not following up the course of antibiotics. Okay, that could be another reason why it is risky. Quality of care, okay, what they have expected, they may not get. Okay, the quality of care in Western countries and developing countries, there is a big difference, huge difference in that, huge gap in that. Okay, so that could be a problem. Communication challenges, language barriers, that could lead to communication challenges. If English is not a common language between the patient and the doctor, and you are not able to find a translator, okay, that could lead to communication challenges. Then air travel is expensive. Okay. Air travel is expensive, risky as well, and not able to reach certain remote countries. You will not be able to reach, or they may not be able to reach out. Continuity of care is tricky. Okay. Once you leave India or you get your medications done, treatment done, and you go back to your home country, and whatever follow up the doctor may have requested, you are not able to keep up with the follow up meetings. Okay. You're not able to keep up with the continuation of care what the doctor have suggested. Okay. That is difficult. If you are in the same locality, it is easier to do follow-ups. Okay. But if you have coming from you go back to a completely different country, to keep in touch with the doctor and do a telemedicine or video conference follow-up is not what some people are used to. Okay. Factors affecting medical tourism. High cost of medical care in developed countries, because of which a lot of people from developed countries are moving to uh, underdeveloped countries or developing countries like India to get their medical care done at a very low cost. Long waiting time for operating procedures. The waiting time even to get an OPD consultation is very long in countries like USA. Okay, to get one consultation done from a specialist, you may have to wait for 6 months, 4 months. Okay, in India, that is not the case. Okay, we don't have such long waiting time. Affordability, accessibility, and availability of international travel. Okay, a travel is available, but is it affordable? Can everyone afford a ticket at tickets to and fro? Okay. Improved healthcare in developing countries. In developing countries, healthcare is improving, but the cost remains still affordable. Okay, that is one of the reasons. Scope of travel with medical care. If you have a medical requirement, even if you are passing through some turbulent nations, war zones, okay, you still have a protection. Okay, even if you are going into a geopolitically countries who have animosity geopolitically, like India, China, India, Pakistan. Okay, but the scope of traveling because of medical reasons is quite easy. Okay, people from Pakistan who seek good healthcare in India, they can come in without much issues with visa if the reason is medical care. Developed tourism industry in India and even in other developing countries. Okay, it is very affordable. Tourism in India is very affordable. Medical tourism for knee, joint, or even hip replacement. Okay, that India is known for these surgeries, knee, joint, or hip replacement surgeries. India is known for that, so that improves the medical tourism in India. Medical tourism providers also have developed as intermediaries to unite potential medical tourists with the provider hospitals and other organizations, which means tourism agency, travel agencies abroad. Okay, they are connected with certain hospitals. Okay, so they seek out potential medical tourists or people. They also have tie-ups with hospitals in abroad. Okay, and if certain patients require consultation from India or some other country, these travel agencies arrange their travel their medical tourism, travel, visa, and everything. Okay, these are the intermediaries. So that's about medical tourism. If you have any queries, please mention in the chat box.